Mr. Speaker, I rise today to talk about service by recognizing individuals and organizations who have stepped up when their fellow citizens needed them most. Through their actions, they have shown what it means to put others before self. Mr. Speaker, I begin by rising today to honor Dr. Tanino Rodriguez, a good friend and devoted servant of the Latino community in Lansing. Over the years, Dr. Rodriguez, or Nino as he's known around town, has had many titles. In each role, he has left a profound impact on the students, faculty, parents, and community residents that call Greater Lansing home. Dr. Rodriguez has spent his entire professional life working in schools, first in Peru, then in Grand Rapids, and then Lansing, where he has worked tirelessly for the past 50 years to improve the lives of children through education. His career has taken him from being a counselor at C.W. Otto Junior High, an assistant principal at Gardner Junior High and Eastern High School, principal at Patton Gill Middle School, and finally, as deputy superintendent of the entire school district. He was an innovator in the classroom, developing a clustered teaching approach that is still being used today. In addition, he led the adoption of guidelines proposed by the Youth Violence Prevention Coalition, which brought about significant positive changes in student and community relations. Since 2009, he has been an elected member of the Lansing District Board of Education, a role that he carries out with joy because it allows him to continue his service to Lansing students. Dr. Rodriguez's passions extend beyond education. He's an officer with the Hispanic Chamber of Commerce and a member of the Ingham County Health Department's Board of Health. But to really know Dr. Rodriguez, you only need to read his monthly magazine, Adelante Forward. Published in both English and Spanish, Adelante Forward has been an instrumental source of information for the Lansing community, advertising new businesses and spreading word about resources from Head Start to classes to COVID vaccine clinics. It's been a key way to reach Latino and Hispanic residents, bridging the language gap in order to improve community relations. And as I'm sure Dr. Rodriguez is proud to know, it's even being used by some Spanish language teachers as part of their lesson plans. The publication wouldn't be possible without the special partners that work to put it together. Danny Lane, Elena Tapia, Patricia Briones, and Dr. George Mansour. In addition, no tribute to Dr. Rodriguez would be complete without mention of his wife of 30 years, Margarita, as well as their 2 daughters and 2 grandchildren. It's my privilege to represent Dr. Rodriguez in Washington, and I'm grateful for his willingness to always speak to me about Lansing's needs. Every time we're able to connect, it's a pleasure to hear about the good work being done to improve the lives of others. I'm so appreciative for his commitment to serving others, and it is my honor to recognize him today in the permanent record of the People's House. Mr. Speaker, I rise today to honor Ms. Lisa Brinker, a resident of Lake Orion who has been there for her community when it needed her most. Ms. Brinker has faced adversity in her life. 3 years ago, her husband passed away from brain cancer. Out of that pain, she found purpose. Over the course of the last year, she has devoted her time to the New Day Foundation for Families, a local nonprofit that supports those fighting cancer and their loved ones. The financial cost of a cancer diagnosis goes beyond just medical care, as I know well. Beyond the loss of income, the increase in expenses, and emotional distress, it is a diagnosis that can consume us entirely. And that's where the New Day Foundation comes in. With an army of local volunteers like Ms. Brinker, they provide resources to give cancer patients hope through financial assistance and emotional support. When her husband was in the hospital, Ms. Brinker was surrounded by family, friends, and churchgoers who helped lighten the load. For her, she wouldn't have known what to do without that help. And it's why she works so hard to make someone else's load a little lighter. During the pandemic, when family members of immunocompromised patients saw a trip to the grocery store as a fraught experience, Ms. Brinker was there to provide for their essential needs. Since the program began last spring, volunteers like Lisa made more than 300 deliveries, helping 125 families in total. They were a godsend during COVID, and not just for their food deliveries. By demonstrating that service doesn't stop, not even during a once-in-a-generation pandemic, Ms. Brinker was a source of inspiration and strength. With an infectious attitude that brightens the day of all she serves, we are lucky to have her in our community. Ms. Brinker has persevered through adversity and loss, and it has magnified her service. With the powerful perspective that comes with experience, she has used it to better her Lake Orion community. As a humble spirit, she prefers that any recognition focus on making a difference. An article in the local paper ended with her asking readers to get themselves involved. And true to form, for this recognition, she indicated that credit should go to the good people of the New Day Foundation. It's a rare soul who can reduce pain and hardship in others, especially when they themselves have been in that position. For her work to honor the loving memory of her husband and her tireless service to community, it's my privilege to recognize Lisa Brinker on the House floor today. Mr. Speaker, I rise today to recognize another Lisa, the ultimate champion and advocate for the disability community in Brighton, Michigan, Ms. Lisa Kokab. Put simply, Lisa is a powerhouse. As a teacher and a mother of 5, including an incredible 10-year-old boy, PJ, who has Down syndrome, she has built and created an incredible circle of support since moving back to Michigan in 2016. At first, when she was scouting schools for PJ, she had to push through being told no. The family wanted to move back to be near to the kids' grandparents, but the first school district that they called referred the students with special needs to those kids. Other schools gave similar responses when she asked if PJ could be placed in general education. That is, until she called Brighton's special education director, who told Lisa that PJ could absolutely go to school with the other students, that if they moved to Brighton, she would work with them. So that's what Lisa and her husband did. Now, Lisa will be the first to tell you that it wasn't always smooth sailing. She's had to overcome plenty of challenges, from PJ's struggles with development to the hurt of hearing intolerant words, and from other families. Lisa has been tested in too many ways to count, but she has turned her pain into purpose by deciding to open Gigi's Playhouse in Southfield, Michigan. And with more than 45 locations nationwide, Gigi's Playhouses are now achievement centers for individuals with Down syndrome. They are spaces that are specifically designed for kids to interact and play with each other while offering free programs to learn how to read, improve their health, develop career skills, and reach their greatest potential. Lisa was the driving force behind fundraising, searching for a location, and pulling resources together. Now, with her dream a reality, she strives every day to realize the vision of Gigi's Playhouses, to see a world where individuals with Down syndrome are accepted and embraced in their families, schools, and communities. In its first year of operation, Gigi served 383 people with Down syndrome, more than half of whom were adults. Since then, they have expanded their offerings, and in order to help more residents, even adapting during the pandemic by switching to virtual programs. Mr. Speaker, I am a firm believer in finding your people, those who will have your back and stay by your side through ups and downs, failures and successes. Without a doubt, Lisa Kokab has found her people in Brighton and at Gigi's Playhouse, and the disability community in Michigan has found its person in Lisa. She's an inspiration to us all, and I'm so proud to represent her here in the halls of Congress. It is my honor to speak these words into the congressional record so that her story can inspire all who read it. Mr. Speaker, I rise today to recognize a stable of the community, the Wong family of Wong Express House in Brighton. Before moving to Michigan, Shua Chi Wong worked as a fisherman and a security officer for his town while raising his family with his wife May in Fujian Province, China. They immigrated to the U.S. in 1991, moving to Brighton 10 years later, where they have built a successful business with a loyal following for the last 2 decades. Mr. Wong, known as Ed around town, is known for his work ethic and attention to detail. His employees rave about the culture he brings to the team. Extremely flexible and supportive, very welcoming and inspiring. I feel honored to work with such excellent people, is some of what they've said. Mr. Wong's character truly came through in his devotion to keeping his customers and employees safe during COVID-19. At a time when restaurants and dining establishments were particularly hard hit by the public health restrictions, Mr. Wong put a plan in place to allow Wong Express House to stay afloat. After closing for 9 weeks, they reopened on May 29th, 2020, as a model for safe service. With a separate enclosed area inside the restaurant, the dining area was transformed into a contactless pickup window for customer convenience. Instead of dine-in, the restaurant trained staff to fully transition into drive-through and carry-out only. The changes were not easy, but the space was turned into a safe, simple, and effective process that limited customer to staff interaction, keeping everyone safe from infection. That ability to adapt, to work through the challenges in order to keep customers satisfied is why I'm proud to recognize Mr. Wong, his wife May, their son Jin on the floor of the House today. Their pride in their restaurant is evident as soon as you walk in the door, and their resilience can be found in their dedication to each other and our community. During the shutdown, when Jin had to travel back to Brooklyn to support his wife and 2 kids, Mr. and Mrs. Wong stayed in Brighton, holding down the fort to make sure that their staff would be taken care of. It's no surprise that on their first day back in business, they were so overwhelmed with support to the point that they completely sold out of food. Now, as they chart a course for the weeks and months ahead, I know that the Wong family will continue to demonstrate the toughness and grit that Michiganders are known for during uncertain times. On behalf of a grateful community, it is my honor to recognize the leadership and staff at Wong Express House by inserting their story of resilience into the permanent record so that it may last for years to come. Mr. Speaker, I rise today to recognize an organization in my district that goes above and beyond by providing job training opportunities for folks with significant disabilities and other barriers to employment. A nonprofit based in Lansing, Peckham Incorporated provides a platform for people to demonstrate their unique abilities by learning new skills and enjoying the rewards of an honest day's work. From career planning to vocational training to employer services, Peckham offers more than 30 different programs that create opportunities for every single individual they work with. Named after the former Rehabilitation Services Director of the state of Michigan, Ralph Peckham, they began serving the greater Lansing region in 1976. Today, they've grown into one of the largest community rehabilitation programs in the entire state. With core values of compassion, community, and collaboration as a foundation, Peckham has broken the mold of what a human services agency can be. They go beyond just matching skills to places of employment. They treat each person, no matter their ability, with respect and dignity. Their holistic approach to each situation allows them to build an environment of trust where each person they work with can thrive. A physical, cognitive, behavioral, or socioeconomic challenge should never get in the way of someone realizing their full potential. To that end, Peckham makes our district and our state a better place to live. At a fundamental level, they help folks to earn economic and personal independence by creating, sustaining, and improving employment opportunities in our community. Peckham is a leader of workplace culture, from how employers view mental health to how to safely reopen as we see a light at the end of the tunnel in COVID-19. For their efforts, they've been featured in Fortune magazine's Great Places to Work list and recognized by the U.S. Department of Labor with the Gold Hire Vets Medallion Award. Mr. Speaker, accessibility and diversity are cornerstones of a modern workplace. They make our economy stronger, bring our communities closer, and demonstrate what our country is all about: equality of opportunity. Today, I'm proud to congratulate Peckham on 45 successful years harnessing the power of acceptance. They develop potential, work with purpose, and deliver results. With these remarks on the House floor, may their contributions to our nation live on in the congressional record. Mr. Speaker, I rise today because in Livingston County, there's a group of retired medical professionals and volunteers that answer the call to serve by staying in action and continuing to train in the event of emergencies. In 2006, the Livingston County Medical Reserve Corps was founded as a public health volunteer team. Today, I'm proud to honor them on the House floor during their work for during the COVID-19 pandemic. As one of the 762 Medical Reserve Corps units in the nation, they are part of a network of locally organized groups that strive to improve the health and safety of our communities. In Livingston County, our Reserve Corps is composed of 194 members with an extra 80 volunteers dedicating their time at the clinic. These folks are registered nurses, pharmacists, physician's assistants, nurse practitioners, paramedics, licensed professional nurses, EMTs, firefighters, veterinarians, chiropractors, social workers, teachers, public health professionals, and others with non-medical backgrounds. They come from all walks of life, but they are motivated to their cause, which is a healthier Livingston County. And their work during the pandemic is nothing short of heroic. They helped with mask packaging and distribution, staffing a COVID hotline, contact tracing, and vaccine support. Without the Reserve Corps, the county would not have been able to respond as effectively. Since the beginning of last year, temporary staff have logged almost 7,000 hours on duty, with volunteers adding another 5,000 hours. These hours represent shots in arms, questions answered, fears put at ease, and more. When our people needed the most, the Medical Reserve Corps stepped up. Their training, designed for full-scale emergencies, was the difference, meant the difference when Livingston County was tested like never before. I'm so grateful for each and every member who have proudly worn the yellow vest of the Reserve Corps. Mr. Speaker, I especially want to recognize Jennifer Kramer, the Medical Reserve Corps coordinator, who has personally put in incredibly long hours in service to others. With their motto of partner, provide, prepare, and protect, the Reserve Corps make the extraordinary seem ordinary. I've seen them in action myself when I visited a vaccination clinic in January. They're organized, efficient, and wholly devoted to the cause. It's my great honor to speak these words into the official record so that future generations can read about these heroes who were there when we needed them most. Mr. Speaker, I rise today to recognize Cristo Rey Community Center, a nonprofit organization that has been meeting the needs of the Lansing community since 1968. As a comprehensive basic needs service center, Cristo Rey is an invaluable source for residents, no matter their station in life. The center's health clinic serves the uninsured and underinsured while offering counseling to those struggling with substance abuse and addiction. Their financial counselors help folks develop healthy spending and saving habits, and their community kitchen serves free hot breakfast and lunch Monday through Friday. In 2018 alone, Cristo Rey served over 56,000 members of their community. They distributed over 357,000 pounds of food and provided more than 21,000 meals to the hungry. Their family health center cared for nearly 2,800 unique patients, empowered 1,500 individuals to manage their finances, and helped families save over $700,000 in prescription drug costs. In addition to these programs, Cristo Rey served as an essential warming center during harsh winters and as a cooling center during sweltering summers for the roughly 5,000 individuals who are homeless in the Lansing area. Every day, Cristo Rey staff live up to their motto, serving individuals, serving families, serving communities, always with compassion, always with respect. Wherever there is a need, whether it's basic or a spiritual need or a societal need, Cristo Rey is there. Yes, they offer support and care, but they also focus on self-sufficiency and honoring the dignity of every person who walks through their doors. For the poor and vulnerable, immigrants and migrants, and all people in need, regardless of language or culture, Cristo Rey is instrumental in the work to break the cycle of poverty and lift the community up. As a trusted organization, they are crucial to building bridges between different parts of the city. In 2019, during the search for a new police chief, Cristo Rey hosted the first community meet and greet for Darrell Green, who became Lansing's chief of police. When our community was rocked by COVID, Cristo Rey was one of the first to retool its programs and offerings in order to start adapting to changing times. These days, with a grant from the DART Foundation, the center has been able to offer vaccinations to residents, particularly in underserved and hard-to-reach communities, which is essential for bringing down the rates of infection and reopening Michigan's economy. For their 50 years of service to Lansing, it's my great honor to recognize the men and women who truly do God's work at Cristo Rey Community Center. May they continue to live out their mission for the next 50 years and for as long as these words remain in the record of the People's House. And lastly, Mr. Speaker, it is my honor to recognize La Casa, a nonprofit in my community that has stood out as a beacon of hope for thousands of vulnerable women and children in mid-Michigan. In 1979, La Casa was founded as the Livingston Area Council Against Spousal Abuse. With just $40 in donations and a part-time director at a desk in a borrowed office space, the organization at first relied entirely on volunteers, selfless local residents who opened up their own homes so that survivors of domestic violence could find refuge. Later on, as it grew, La Casa was able to rent and then buy and finally expand to a permanent shelter where women and children can access counseling services, legal advocacy, and wraparound support. In addition to Sanctuary, La Casa offers 24-hour crisis response with trained staff who are able to intake and serve the diverse needs of survivors of child abuse, domestic abuse, and sexual assault. For so many in our community, the folks of La Casa are directly responsible for giving them the tools and strength to begin the road towards a better future. However, pandemics don't stop abusers. In fact, when outside stressors occur, abuse historically tends to escalate. So when shelter-in-place orders took effect last year, closing La Casa in its around-the-clock facility was not an option. Record numbers of victims seeking help and refuge contacted them, and their ability to adapt is nothing short of heroic. In 2020 alone, La Casa provided 1,170 overnight stays in hotel rooms and over 3,500 off-site meals for victims and their families. They expanded capacity to handle a 230% increase in child forensic interviews. La Casa saw the number of calls to their 24/7 hotline nearly double when the number of individuals seeking personal protection orders more than tripled compared to an average year. Mr. Speaker, I've had the chance to personally visit La Casa, touring their shelter and working with the president and CEO and badass Babette Schrand on several occasions. I'm so thankful for her leadership and for the entire organization's tireless support and work to provide a port in the storm for local residents. They are a model for similar nonprofits, earning national accreditation from the National Children's Alliance as a children's advocacy center just last week. Babette told me herself. It's their highest level of membership, an honor that says everything about La Casa's dedication to addressing childhood abuse in Southeast Michigan. Today, I'm proud to lift up their trauma-informed procedures and practices as a shining beacon of hope in Michigan's 8th District. On behalf of a grateful community, thank you for the work that you do, and may you continue to lead the way. And with that, Mr. Speaker, I yield back.
Pursuant to Section 11